lottery. Thank you, Deputy Speaker.
Member for Werriwa.
Thank you, Deputy Speaker. Health is always a first-order issue for Australians, but particularly for the people of the electorate of Werriwa. Constituents consistently talk to me about how much they care about health and education of their children and families. Healthcare is one of the key services the Australian government delivers, and for the Albanese government it is a cornerstone and a key priority. Medicare is Labor's DNA. It was true when Gough Whitlam first introduced Medibank. It was true when Bob Hawke later restored it after it was abolished by Fraser. And it is true to this day with the Albanese Labor government injecting historic amounts of money to improve the system. The last election, the Prime Minister was often seen with his green Medicare card on display. And why wouldn't he? The card is a guarantee of free access to the finest healthcare system in the world. There is no lottery, no luck, no chance in the provision of Medicare cards as suggested by the member for Fowler. All Australians, Deputy Speaker, regardless of postcode, education, wealth or ethnicity, are entitled to one. The Prime Minister has one, I have one, the member for Fowler has one, and the newest Australian citizens have one. Of course, we can always improve the Medicare system, but we need to be clear. A universal healthcare system is the envy of the world, and talking it down unnecessarily belies the fact and devalues the wonderful healthcare workforce we have. Front and foremost in our healthcare system in Australia is recognising that GPs are the front line as primary healthcare workers. They need to be respected, valued and, more importantly, remunerated. The improvements from the 1st of November to GP payments do this. Not only have those improvements ensured GPs are appropriately paid, but they have a significant improved bulk billing rates. The success of the $8.5 billion injection into Medicare by the government is undeniable. There are now over 3,400 Medicare bulk billing practices across the country. That's almost 1,300 more than previously were mixed billing. And the bulk billing rate for all Australians has increased to 81.4% nationwide. These statistics mean that because of the Albanese government's policies, 96% of Australians are now within a 20-minute drive of a registered Medicare bulk billing practice. In terms of the electorate of Werriwa, there are 32 Medicare bulk billing practices, that is 7 more than before the 1st of November. 91% of practices in Werriwa are now bulk billing all their patients all the time. Interestingly, the constituents in the electorate of Fowler, with whom I share a border, have a choice of 94% bulk billing practices, and that is the highest in the country, and it's 9 more than the 1st of November. The Albanese government has further supported South West Sydney and the residents of Fowler and Werriwa by investing $80 million to upgrade the Fairfield Emergency Department. Werriwa also has a new urgent care clinic in Austral, which was promised during the election campaign. It opened on the 27th of January and has already seen 280 people in the last 4 weeks. The government has also made a massive $25 billion investment into the public hospital system, which was recently announced by the Health Minister and the Prime Minister after negotiations with all the states and territories. But there is also the $792 investment into women's health, which is changing so much how women's health is looked at in this country. There's the cheapened medicines, which from the 1st of January meant that PBS scripts were only $25 or $7.70 with a concession. In my electorate of Werriwa, constituents have saved more than $8.2 million with over 1.3 million cheaper scripts. And then there is the historical investment that the government has made into mental health, which has seen Headspace in Edmondson Park, which is doing such great work. The motion moved by the member for Fowler referred to a lottery, but the winners of this lottery are the people of Werriwa, Fowler and the wider Australian communities, who have a government who in all aspects of health are improving the lot for all Australians.
Thank you. And the discussion has now concluded.